put in your user ID and password. Close the splash screen and you will see all the patients in the particular unit that you're working in. The rooms are in chronological order. The status displays if the bed is occupied, or if they are pending discharge, you will see a PD with a date and a time. If the doctor has put in the discharge order, this will display on the unit patient list. You are also able to see the patient's information, their name, their MR number, their sex, age, and who the attending physician is for that patient. The main screen also contains the banner up at the top where you're able to go to a patient search to view other patients within the hospital. If you need to go look at a patient in a different unit, click on the patient search button at the top. You can enter an MR number if you need to, but the easier way is to click on the little arrow, pull it down, go to the folder that says Census, and you will be able to see all the different units within the hospital. So if your patient got moved to DOU and you need to go document on them, you do have access to pull up their chart. You have access to all the other inpatient units, as well as patients who are active in the ER. You can close any of these applications by clicking on the little X, and it will take you back to the patient list. To access the patient information, you will double click on the patient name, and it will launch you into the patient's chart. At the top, you still have the banner, and you can go to the big house in the corner, the main desktop, and it will leave your patient open, but you can access a second patient if you need to. You will have both patients open at this point. We do recommend that you close the patient's chart if they are not being actively used. That way it doesn't hold up any discharges or admissions on the patient. It does stop the discharge orders from filing if the physician is putting them in at the same time that you have the chart open. So please close them if you are not working with them. To close the patient's chart, you just click on the little X right next to their name, and it will take you back to the main screen. To go back into your patient, you will, once you open it, you have the patient name, their MR number, their visit number or account number, their location, sex, age, date of birth, who their attending physician is, and if they have any special privacy issues. Once you've logged into the patient chart, you're able to see the first of 4 applications here that you will interact with. The first one is your inbox. This is where you will go to sign off on any orders that have been put in on the patient, and this is where you will also see any new orders that have been placed. Once you sign off on your orders and acknowledge them, they will disappear from your list, and any new orders will then populate a new number in the orders column. To start this process, you can click on the number at the bottom where the total is, or you can click on the arrow coming out of the box. Any of these applications that you see with an arrow coming out of the box will launch that particular application. So I will click on this number here, and you will be able to see all of the orders that have been placed on this patient so far. These are the admission orders that automatically get ordered on your patient, such as the admission assessment, the shift assessment, etc. To sign these off, you can do this one of 2 ways. You can select all with the button at the bottom, and you'll notice it goes gray to select, and you can say sign review here at the bottom. Once I hit sign review, it will sign all of your orders off at once and disappear from your screen. You can also open one by one if you needed to, such as if you had a medication. And once you open it and view the information, you can then sign this off by clicking on Accept Final Review. Once you sign it off, it will disappear off of your list. I'm going to select a small group of them, click Sign Review, and you'll notice that they disappear and my number changes down to number 9. You also are able to see any critical and abnormal values, labs, vital signs, anything that gets documented. If it is deemed critical or abnormal, they will display in this column separately. Stat orders will also go to its own column. This will display in red, bold, and underlined. We don't use the action items column, so you can skip that. The results review, this is where any lab results will go that you need to review, radiology results, for you to take a look at. The ASO orders to review column is for automatic stop orders. Narcotics and antibiotics need to be renewed after a certain number of days. Narcotics will expire after 5 days and antibiotics after 7 days. So the day before they are set to expire, they will display in this columns to remind you to go ahead and either renew or it will expire. The doctors also see this and are able to renew the medications on their own, but we also send it to the nursing staff to review if they need to and remind the doctor. Empty. You can close this application by clicking on the X right below the patient X. So that way it closes that particular application and brings you back to the main screen again. Right next to your inbox is the nurse communication tool. This is not a part of the patient's chart. This is strictly meant to be a tool to communicate between caregivers. It displays on nursing's desktop. The ward clerk can see it, the nursing aide can see it, physical therapy can see it, and so can case management. That way, if they need to see any other information, they are able to see important information such as next of kin, phone numbers, if the patient is a risk of danger. These notes do not delete from the chart when the patient is discharged. So to add a note, you can make this application bigger, click the Add button down in the bottom left-hand corner, and I recommend putting in the date. A shortcut would be putting in the letter T and hitting Enter, and then you can go ahead and free text whatever note you want. Once you're done with your note, click OK and Accept. It will then file that into that screen. You can then close it, and your note will now be part of the nurse communication application. The notes are not proprietary, so if the note is no longer something that needs to be on the patient's chart, you can open it up and delete. Click the delete button, select the message you want to remove, click OK, and then say yes to verify the deletion. It will then file and the message will go away. Right below the nurse communication is your MD2RN treatment orders. These are orders that are considered standing orders by the physician, and we generally use these as free text orders that they might put into the system, such as transfuse 2 units of blood if the patient's H&H falls below a certain number. We don't know when this is going to happen or if it's going to happen, but you do have a standing order to be able to act on if that is needed. Another example is in OB. They may put in standing orders for if the patient desires epidural, they may have it. That way you don't have to call up the physician and ask for permission. To the left of that screen is your patient's face sheet. You can make this bigger as well, but you can interact with the tabs while it is in its small position here. You can also make this bigger to make it easier to view. Basically, this information is driven by documentation as well as ordering. You can see the patient's admit date and time, which comes from our registration system. You can also see what diagnosis that they put into the system. If the patient's code status has been entered, you would be able to see that here. If they're on isolation, if they're on telemetry, have a sitter, if they're homeless, what their diet order is, their height, their weight, etc. So as this information is entered, it will fill in this information. It will also update as new information is put in, such as if you put in a new height or weight, that would update this particular screen. It would also display the date and time that information was updated. You can move through different tabs to be able to see allergies, vaccine status. When you document your shift assessment, you're able to see the ADL information will flow into here. Precautions such as suicide precautions, seizure precautions, if those have been ordered on the patient, they will display on here. The registration information such as advanced directive, privacy status, who their surrogate person is to make their decisions, language spoken, all of that information comes from the registration system in Affinity. Last set of vital signs will display here, as well as a last set of lab values. The last three tabs are for OB, the newborn, maternal, and delivery information. When they document that, will display in those three tabs. If you don't work in that department, don't worry about it. I'm going to close this, click on the little X, and it shrinks it back down. The ePrescribe portal you don't really interact with, so we're going to leave that one alone for right now. You do have other tabs within the application that you can move through. As well as shortcuts on the left-hand side. The shortcuts are where you're going to do most of your documentation. You have a work list that you will work through to be able to do your assessments. It will give you a list in chronological order of what needs to be done for your shift. You're also able to see the unscheduled documentation that you have access to in case what is already scheduled and ordered is not displaying on your work list. So if we start at the work list and click on that, it will show you what we have to do for our shift. If this is a brand new patient, as this is, we have a few things we need to take care of. The admission assessment is here. Here's your allergy assessment. This allergy assessment that is in the work list is also available on your shortcuts. The exact same documentation screen. So if you don't have time to quickly get into your work list and start working it, you can go to the shortcut for allergies to be able to document those. Once that's been entered, then they will disappear from your list if you've documented off of your work list. So we're going to start with an allergy assessment. Double click that to open. It will then give you an option to document, or you can cancel it if for some reason it's already been done or you've done it off of your shortcuts. So for this example, we're going to go ahead and click on document. You are also able to change the time if you need to in the past, but the default will be now, which is fine right now, so we're going to click OK. Next, you are able to document the allergies on the patient. You can also, if the patient has been here before and they already have allergies entered, you can also click the verified button to document that you verified that no change has occurred with the patient's allergies. If the patient is non-responsive and you want to document that you don't know them or you're unable to assess them, you can click these buttons as well. So to document a new set of allergies, which this patient is brand new and does not have any previous entries, I'm going to click on Document. It will ask me, is a bracelet applied? If the patient has an allergy, you would make sure this is your reminder to go ahead and put in an allergy bracelet. If they don't have any allergies, then just say no. If the patient does not have any drug allergies, it's going to either give you the document drug allergy option or NKDA for no allergies. Then it will move you on to the next field, which is for the latex allergies. And again, you can document the latex or you can say NKLA, and it will move you on. Same thing with food, and the same thing with any substance or environmental allergies. Once you've put in all of your NK, DA, LA, and FA, and SA, it will display, and you click OK to complete with an accept. Accept is like a save button. You're able to click on that and it will file that entry. You'll notice that it now has disappeared off of my list and my allergies have now been entered. You will also see that you get a red triangle up at the top, and it displays my allergies and assessment on there. I can also hover over it, or I can click on it and it will display my allergies here. If they had allergies, they would have also displayed any symptoms, severity, etc. Once the doctor has entered the code status on the patient, you'll also be able to see that here in this red triangle. The hemodialysis, if they're on hemodialysis, that would display on here. Orders for isolation would display and what type. So this triangle is meant to give you quick information without having to look for it throughout the system. To close this, click OK. And you can go back to the work list to start on the next item. The height and weight is also entered here. You can also enter it by clicking on the little arrow, and here it has the height and the weight in this particular section of the shortcuts. Same type of screen, it's just in a different place. So I'm going to go ahead and use the one from my work list and double click to open. Again, you can document. Now is fine. And since I am not doing this at the time that it was ordered, which is at 10:45, that's fine. Just click Document Currently Selected Event in order to proceed. If the patient had been here before, their height would have been brought forward. But this patient has not been here before, so you will have to enter the patient's height. Now there's a couple of different ways that you can do this. If the patient is 5'6", you can type 5FT space 6IN, 5 feet 6 inches, and then you hit enter. It will drop you into the weight. You click document weight, and it's going to ask you for a weight in kilograms. If you are entering in pounds, you need to follow it with the LBS after the number, or else it will think that you mean kilograms and the patient's weight will in effect be doubled. So if the patient weighs 135 pounds, you have to type that LBS and hit enter. And how you took the weight, we used a standing scale. And you'll notice that here's my 135, and it converts it to kilograms for me. I hit enter, and you'll notice when it pops me back, here's my weight, and here's the height, also converted in centimeters. Here's my 5 feet 6 inches, and also converted into just inches. I have my BSA, BMI, and other information displayed based on this information that I entered. Another way you can enter the height, if you don't want to type in 5 feet 6 inches, you can use 5'6" and that will also update the patient's chart. Once I'm done, I click enter and say accept, and it will file. If I click on the patient's name here on the side, it takes me back to the main screen, and you'll notice I am back at my face sheet. If I refresh the screen, I can now see that I now have a little bit more information for the height and the weight, the BSA and the BMI. And here's that date and time that I told you about. So you can see that on the work list, most of the documentation starts out the same. You can basically double click it to open it and click document to get started. The next item that we'll go through is the medication history documentation. This can also be accessed through the order management, which we'll look at when we go into that module. But we can also enter the home medication history right here off of the work list. I'm going to double click it to open it. Click on document. Now is fine. Document the currently selected event because I'm not doing it at the normal time. And I can then add new home medications to this list. If this patient had been here before, those home medications would have come forward. You can also document if the patient does not take any home medications. There is an option for no home medications. If the patient cannot tell you their home medications and maybe they'll bring it at a later time, maybe a family member, you can document, at least at this time, unknown home medications, and they can always be updated at a later time. So for this example, we'll click on the add button, and you would put in the name of the medication that they take at home. Hit enter or OK, and it will display for you all the options you have to pick from, including any combination medications such as lisinopril hydrochlorothiazide. My patient's going to be taking 10 milligrams, an oral tablet, and you hit enter. It will then ask you again for the dose, since you may be taking 2 10 milligram tablets, but with this one we'll just be taking 10. It will then ask you for a frequency. This pill is taken every day, so I'm going to go to number 13. You can double click this if you need to. And it also gives you a field to put in when it was last taken. You'll notice that this field is not bolded. Whenever you're documenting and you have bolded fields, that means that it is a required field. This field is not required, so I can actually just hit enter if I don't know the answer to this, and hit enter until it takes me back to the original screen. At this point, I can add more medications. If I made a mistake with that previous entry, I can also click the remove button to take it off. If the patient had been here before and they are no longer taking a medication that popped up on the list, you can use your discontinue button to take that particular medication off the list so they don't even go to file. So I'm going to add another medication. Click add. The next med I'm going to enter is a pain med or a PRN med. I'm going to select Norco. It's going to give me the different dosing options. And since this is a combination drug, we can put in either tablet or capsule instead of trying to put in the combination of milligrams. So I'm going to select number 2 and put in 1 tablet or 2 tablets. Doesn't seem to like ranges, so need to pick one or the other. Since this is a PRN, we do need to include the PRN with the frequency hours. So I'm going to select that first, as well as the number of hours. If none of these hours are appropriate, you can always select number 5, where you can enter your own number of hours. It will then ask me for a process condition, and I'm able to put in why this medication is being prescribed. You can select off the list, or you can enter free text. Anytime you see the transaction line with the option for or enter free text, you can just start typing. and then you can say OK or enter, and it will ask you generic allowed. That's fine. When was this last taken? Again, not required. You can hit enter to go past it, and hit enter one more time, and it will bring you back to your main screen. You can now see the two options that we've entered, and I'm going to add a third medication, some digoxin, and again it's going to ask for what form and dose this is being given, and again how much the dose is each time they're taking it, and how often they are taking it. If this is a medication that they are taking for a specific period of time, you can enter that amount of time in the frequency. So if they're supposed to be taking the amoxicillin every 8 hours for 10 days, you would select number 3 and number 12. Hit enter, and then you can enter the number of events for the time interval. So if this is for 10 days, you can put 10 days. If it was just for 10 events, you would go ahead and just leave it as 10, but we'll go ahead and say days for this example. Again, last taken, I'm just going to skip past that, and it will put this on the list. Once you're done, hit enter and accept. It will file it, and then it will ask you for the patient's preferred pharmacy. We do have a list that you can pick from, or you can enter free text. I'm going to pick Walgreens and El Centro, and then we can also document that the list is completed, or if it's still incomplete, it will send out a reminder to the patient's work list to go back and continue putting in the home meds once you have the list. I'm going to hit enter and accept. Again, it fell off of my list, and I still have to do my admission assessment, and I can also do my routine charting, system reassessment. The routine charting is your every 2-hour charting. We do every 2-hour charting. We do not chart by exception. You also can document your intake and output. If the admission assessment is done, you don't need to do a shift assessment until the next shift. You can see here's the 2000 event. The admission assessment is a longer version of your shift assessment. When you do the shift assessment, the system assessment from head to toe is basically the same as your admission assessment. So that much isn't changed. It's just the admission assessment is going to ask a lot more questions. So to do the admission assessment, double click it. Again, click document. Now is fine. And then it will drop you into documenting any prior health history issues, or if they don't have any, you can click the button that says no, they don't. So if I click document health history, it's going to give me some options, what kind of health history they might have had. You can pick off the list, or you can enter free text. You can also document any injuries they might have had. If they haven't had any, you can just hit enter to go past. You'll notice it is not bolded. Any previous surgeries they might have had. Again, if they haven't had any, you can go past it, or if it's not on the list, you can enter free text. Hit enter again, and it will also ask you about any other routine physicals they might have had, breast self-exams, prostate exams. If not, just hit enter to go past it. It'll also ask you for documenting the functional assessment, whether they have any dysfunction in their limbs, and you can document any of that. If they do not have anything, then you would have been able to say they do not have any issues with that. Not applicable. You can also document any family health history if it's pertinent to this patient's charting. If not, just say no prior illnesses, diseases. The tobacco, alcohol, and drug use, you can go ahead and click on the button and it will take you in to document the alcohol. Here you can say they do not drink any, occasional, daily, monthly, weekly, what they drink, and you can also document the amount. I'm just going to say none. Tobacco, if they have never smoked, former smoker, current everyday smoker, occasional smoker, or if it's unknown, you can document any of that information. So I'm going to say this patient is a former smoker. When you select that option, it's going to ask you for the date started and date quit. If you just start typing, it will tell you you're using the wrong documentation. So you can put just a single year if they can't recall when they started. Let's say it was 1985, and when they quit was 2000. You can also document how much they smoked per day, per pack, if they smoked cigars. If they've been counseled on smoking cessation, you can document that as well. Number of packs is 1. And you can also document if they've taken drugs, if they do, how often they take it, when it was last taken, and any routes. So I'm going to say this patient never used drugs and hit enter one more time. It will then move you on to asking about tobacco use by the family or significant other or anyone else in the home. I'm going to say none for this patient, and you've completed the first screen for the admission assessment. Now you can either click on the button that says next screen in the bottom right hand corner, or you can use your keyboard on the page down button that will take you to the next screen. Either way will work. Next, it's going to ask you who is the informant for this particular patient's information. If it's the patient, you can document that or any other family member or friend. You can also enter free text if you need to, but this is a required field and you need to put something in. Chief complaint, this is completely free text. I can enter whatever the patient has told me. You can also document who to if you've contacted the patient's PCP. Do they want them contacted? No, they don't want them called. They're aware already. They don't have a PCP, or if the patient cannot respond and tell you their wishes, you can select the last button. So maybe if the patient's already aware because their doctor is actually here, you can document that. And same thing with family. Do they want us to call their family to let them know that they're here? Or again, if they're already aware, you can document that. And hit enter. The admission temperature, pulse, respiration, blood pressure, O2 stat, and pain level can be entered. When you document the pain level, you click the button and it will ask you for the pain scale type. For this patient, I'm going to pick the numeric scale because they can tell me what their pain level is, and I can select whatever they tell me. Then you'll be able to put in where the location is of that pain and how bad the description is. And maybe it's dull and aching. You can select multiple entries if you want to, or again, you can enter free text. The acceptable pain level is how much pain this patient is able to tolerate before they are asking for pain medication. If they're unable to answer, you can click the button down below, but this is just looking for a simple number. So if the patient tells me 3 is the most they can go without pain medication, I can enter that, and it moves me to the next item, which is to document the weight, which we did already, but we need to put it in again. Remember to put in LBS if you're putting it in pounds. If you are measuring their weight in kilograms, you can just put the number, and it will convert it for you. Documenting the flu vaccine status. You can click on Document Flu Vaccine Status button, and it will ask you for any kind of exclusion criteria. If it is not flu season, you do have the option to say vaccination unavailable, it's not flu season. If they have any allergies to eggs, latex, a history of Guillain-Barré syndrome, you are able to also give any other exclusion criteria. So since it's July, I'm going to go ahead and pick that the vaccination is not available. And it will ask me if this was previously given. It is not a required field. You'll notice that this is not bolded, this number, and you are able to go past it. Then it's going to drop you into documenting the pneumococcal vaccine. And again, you do have exclusion criteria. If they do not have any exclusion criteria identified, and the flu vaccine works the same way, you select no exclusion criteria, and then they want to know if the patient meets inclusion criteria. Same thing with the flu vaccine. Maybe this patient has diabetes, and you can say, is this indicated to give? If you say yes, then it will automatically order the vaccine for you onto your BCMA. You don't need to go and order it separately. It does it automatically in the background. And it will also again ask you when it was previously given. I can hit enter if it was not given to skip it. Now I'm dropped into documenting any possessions or valuables. If they've been sent home, you can click that button. If they don't have any possessions, you can click that one. If they do, you can go ahead and select document and select what type of valuables they have. So if the patient has glasses and a cell phone and their purse, I can select all three. And what happened to all of these items? I'm going to keep them by the patient bedside and hit enter again. ID bracelet is the correct identification bracelet on the patient. This is simply a reminder to make sure that that is the correct ID bracelet on the patient. And what language do they speak? If I select English, it moves me on to ask if an interpreter is needed. No, they are not, and it moves me on. Unit orientation, if you oriented them to the unit, you can document specifically what you oriented them to. Name preference, I'm going to skip that one because it's not required and they don't have anything different. And what is their transport mode? Are they able to ambulate, stretcher, do they need a wheelchair? You can select off the list. That is the next screen that has been completed. I can again click on next screen or page down, either one will work. Pain presence. Do they have a history of pain? Yes, no, or unable to assess. If you say yes, it'll ask for more information. If you say no, then you're pretty much done with that screen. Do they have any tubes, drains, or lines in place on arrival? Central line, feeding tube, Foley catheter, midline, PICC line, or no, they do not. This is a required field, so you will need to pick something off of this list. If they don't have any tubes or drains on arrival, you can select number 6. Any cultural practices we need to document, or you do have unknown. We can document their religion if they're requesting a clergy visit. You can also document their family framework. Do they have a family? Are they single? Are they married? Are they living with their family? You would document whatever is appropriate. Who is their support network? If they don't have any, entire family, whatever's appropriate. and you do have a section here for any kind of free text comments. The first system assessment you'll document is the neuro assessment. So the way this is set up is you have a within normal limits and you have within normal limits except. So if they have multiple exceptions or even just one, you can select off of the list which exception you want to specifically address that is not within normal limits. You can select one or more than one. I'm going to show you what it looks like when you pick within normal limits so you can see what happens. So I'm going to say OK. It's still going to drop me in to document the patient's LOC. I can document that, and I can document the patient's reflexes. Their gag is present and Babinski is absent, and how's their limb strength. They move all their extremities, normal power. Care transition diagnosis, do they have any of these diagnoses when they came in? I'm going to say they had a stroke. And it will drop me into documenting the comment. Now when I picked within normal limits, it automatically filled in all of this information as normal. Their motor response, their pupils, swallow, appearance, etc. So by clicking within normal limits, it fills in the fields as normal responses. If I go back into that field and click into the within normal limits and change this to say that the patient is within normal limits except hearing and speech, I can then click enter and it leaves my speech field empty for me to go ahead and document what the problem is. So I can go ahead and document my speech and say they are having difficulty speaking, maybe they have some expressive aphasia. Any voice description changes? If not, just hit enter to go past it. Pattern, same thing, no deficit, you can document that. Hit enter. The hearing field, you can document that and say the patient is hard of hearing and they don't have any hearing aids. Any sensation issues? No, they don't have any unusual sensations. Enter, and that information is now entered as not within normal limits. For each of these sections, you do have a comment section at the bottom. You also have fields for the smell, taste, and touch. They are not going to drop you into them, but they are available if they are pertinent to your patient. Also, the coma scale is available in case you need to enter that information. If not, then you're done and you can go to the next screen. Here's my cardiovascular assessment. Again, I have options for within normal limits and my exceptions right below. So with this one, I'll go ahead and say the patient has some edema and say OK. Do they have any chest pain? If they do, you will click document. If not, no chest pain. Since I did put that the patient had some edema, you can document that with where it's at. Upper, lower, if it is lower, where it's at, ankle, below the knee, pedal, and what the description is. Trace 1+, 2+, 3+. So I'm going to say they have bilateral lower, below the knee, and it's 1+. This will also ask you if the patient's being monitored, either by telemetry or a monitor. If you say yes, then it will give you the option to go ahead and document the cardiac rhythm. So the patient has sinus rhythm, and do they have a pacemaker, yes or no? This is also a historic field, so when the next shift assessment comes up to document, this pacemaker answer will already pre-populate, so it does not have to be answered every single time. You'll also notice that the pulse and blood pressure populated from when we entered from the first part of the admission assessment. and they are in blue. These are just being pulled forward into this field. If you are interrupted and you need to save this as partial, you can. Click OK, and you will see that you have started this. You notice that these are blank on this last column, but I still have more data I need to enter for the rest of it. So to save this, just click OK until you get a partial accept. Once you accept as partial, it saves what you've been doing, and you can go back and finish it at a later time. The system does not save as you document, so you must save it as partial or you will lose what you're doing. The system will also log you out after 5 minutes if you get up and walk away from the computer, and if that happens, you will lose whatever you were in the middle of documenting. You can now go back to your admission assessment to finish it. You'll notice that it does say partial instead of scheduled. You can double click it to open it. It will display what you've already started documenting on. Click on Document, and you can then pick up where you left off by clicking on the item that says No Data. So I'm going into my respiratory assessment, and I can go ahead and document. I click No within normal limits. Everything got filled out. I can then go on to the next screen. GIGU. I'm going to say within normal limits. It fills it out for me. I can also document if the patient has when their last BM was. The C. diff screen is a screen where you're just going to click into and be able to document if the patient has any risk factors for C. diff. No greater than or equal to 3 episodes of watery diarrhea in the last 24 hours, or if they have this risk factor along with any of the risk factors below. If they do, then they would be at risk for C. diff. If I select 2 and 3, it will ask you subsequent questions, whether or not they're using any kind of laxative, yes, no, or unknown. It will ask you if they've used a bowel prep such as Go Lightly, and if they are on any tube feedings. And you always have the option for yes, no, or unknown. If they meet the criteria for that particular protocol, then the C. diff test will be ordered automatically. The next field is the diversions, tubes, drains. You have options for number 1, 2, and 3. If you click on this, it will show you a list of some common diversions, tubes, and drains that you can pick from. If they do not have any, you can document no, they don't have any in place, or none on arrival, and that satisfies this particular question. It is a required question. If they have more than one, you will select one at a time off of the list. So if the patient has a colostomy, I can select that, and it will then give me a place to document about that colostomy. If they also have a JP drain, it will then give me my JP drain documentation. You usually don't have more than 3, so 3 seems to be the limit on these. These are now required fields, and these answers for number 9, 10, and 11 will go from shift assessment to shift assessment. So that way we don't forget that they need to be documented on. So I can then document on my JP drain. What number is it? They may have more than one. You'll do one at a time. It's in their left lower abdomen. Say okay. This is number 1. And how much output has this JP drain put out? You can either document in milliliters if it's sufficient enough to measure, or you can use the alpha response if you can't measure it. So you've got scant, small, moderate, large, or copious, and you would basically just type the letter that's in the parentheses to designate which one. So this one's going to be scant, so I'm going to enter the letter T. And what does the drainage look like? This is not a required field because you may not be able to document anything if there is nothing in that particular bulb. So this one I'm going to say is burgundy. And what does the site look like? The site is healthy pink, it's tender, and it's warm to the touch. So that's your documentation for your first JP drain. If they have more than one JP drain, you can document another one and click on the same items. This would be number 2 in the left upper abdomen, and this one we were able to get out 15 mLs. Then you would be able to document it. And how does that site look? Once you're done documenting any drains, just hit enter, and it brings me back to then document about my colostomy. And you can document how much drainage came out. Since there would only be one, it does not ask me to document a second colostomy. If the tube or drain has been removed, you can go back into these fields. If you are documenting a shift assessment and it is still populating, you can go back into that field and make the change to say that there is no tube or drain in place, and it will stop requiring you to enter documentation about that tube or drain. It does not affect any past documentation. This is just for the documentation going forward. Also, any fields that are female or male oriented will display if they are female or male, and not display if they are not. You still have your comment section you can go into if you need to. Next screen is your skin assessment. Again, I'm going to say this is within normal limits. You still have those options to say except if there are specific items that you need to document. It then drops me into the incision or wound. You can document if they have any or if none are observed. We do require you to document that, and we do require you to go into that field to specifically say if they do have any wounds or incisions or if there are none observed. If you do have any incisions or wounds, it will let you document like it did for the JP drain, where you're able to document the incision or wound separately for each one. So if they have 4 incisions, you're able to document 4 of them separately. Don't try to cram them all into one entry. So I'm going to say none observed on this one, and pressure ulcers are documented separately, so you can actually see there is another field specifically for the pressure ulcers. And again, you have the option to either document that pressure ulcer or say none observed, and it will walk you through the location, stages, description, fields for you to document each one separately. There is a second RN LVN skin verification. I can put in the last name of the person who is verifying it. Click OK, and it will show that person's name to select. The Braden scale is answered each part separately, and it will give you a total score at the bottom of the screen. So it starts with the sensory perception, and the no impairment, the higher the number, the better off they are. So you have your no impairment, slightly limited, very limited, or completely limited. I can then go ahead and select whatever's appropriate for my patient. Just double click on the response you want to pick, and it moves you on to the next field. So here I'm dealing with their moisture. Are they moist? Rarely, occasionally, very, or constantly? How's their activity? Do they walk frequently, occasionally, chair fast, or bed fast? How's their mobility? No limitations, slightly, very, or completely immobile. How's their nutrition? If it's excellent, it gives a definition of what they expect that would be. Adequate, probably inadequate, and very poor. Any problems with friction or shear? You have no problem, potential, or yes, they have a problem sliding around in their bed. It will then give you a total score here and tell you what risk level that they are at. If the patient is at a risk level of low, moderate, or high, it will automatically kick off a training schedule on your work list. The IV site, you can document the IV. If they don't have one at this time, you can always say it's not present. And here you can document what type of IV site that they have. The peripheral IV, heparin lock, saline lock, if you select any of those, you're able to document where it's at, left, right, and then any modifiers you might want to use. So I'm going to say this is in their left antecubital. And you would also be able to document whatever fluid that they're being infused with and at what rate. You can also document the patient's IV gauge, but it's not required. This is something that pediatrics asked for. So you can actually just click enter to go past it, and you can document what the description of the site is. No redness or edema, no discomfort, it's soft, and it's warm to the touch. Again, you can enter multiple sites for your IV. If they have a flowing IV and a saline lock on another arm, then you would be able to document each separately. With this patient, I'm just going to leave it as one. Any other accesses that they might have, an art line, AV shunt. If they don't, then you can go ahead and say, nope, they don't have it in place. Is the patient diabetic? If you say yes, then it will ask you another question if they have any diabetic ulcers or wounds. If you say no or unknown, it will take you to the next question. Here you have your med patch assessment. Do they have any medication patches? Again, this is serve as a reminder to make sure you're checking your patient head to toe to see if they have any medication patches in place we may need to deal with. If they do not, you do have the none observed, but if they do, you can document the name, location, date applied, and was the patch removed or not. Nutritional screen. Do they have any issues chewing, swallowing, or both? You can select it, or no difficulty. Do you have the patient on any supplemental or enteral feedings? Yes, no, or maybe they weren't unable to provide the information. Do they have any wounds or ulcers? Yes or no. And has the patient recently lost weight? Do they have they been eating poorly for greater than 5 days? Then it will give a malnutrition score right above it. And if you do need to have a consult with the dietitian, you are able to select what the reason is. And say OK. And that will then send a request to the dietitian to come and evaluate the patient. Next screen. You have your psychosocial language assessment. Here we have our within normal limits again for comprehension, mood, affect, sleep, and rest. And then it's going to ask you for a violence risk assessment. Does the patient exhibit risk of violent behavior? You can say yes or no. If you say yes, it's going to say that you need to put up a bold A sign outside the entry of the room and the head of the bed, and make sure that you communicate it to the rest of the patient care team. The language spoken is already being brought forward from the first screen that we documented what their language is. If we had documented that they spoke Spanish, for instance, it's going to ask in bold if there was a translator needed. If you are the person who's actually speaking to them and understand them, then you would say yes yourself. If you had to utilize other staff, you would be able to put in that person's name. If it was a language other than any that we speak here in the hospital, you would be able to utilize the language line and would need to put in the interpreter's name and ID number. If it's a member of the family or a friend translating, you can document that as well, or you can just use yes or no and document anything else free text. ADLs. These are all required fields, and we'll take you in to address each one separately. Here it's asking if the patient has any issues with feeding. They must be fed, they're independent, maybe they have a feeding tube for their nutrition. I'm going to say this patient is independent and say okay. Bathing, do they need help with that? Or if they're not able to do it themselves? You can also say they require assistance to bathe. If that's the case, then you would just need to document how many people need to help this person to take a bath. 2 staff, and you can say okay. How about dressing? Are they independent or do they require staff, and how many? Grooming, same thing. Toileting, ambulation, and maybe they just need 1 person. Tolerance, when they do ambulate, do they have any fatigue, shortness of breath? Are they able to full weight bear or partial? And how are they able to transfer with assistance or independently? And then next screen. Do they have to use any lift equipment? Yes or no? And we have the fall risk scale, the Morse scale. Same idea as the Braden scale, where you would document if they are have a history of falling, no, or yes, they've fallen in the last 3 months. Do they have a secondary diagnosis? Yes or no? Ambulatory aid, do they use any kind of an aids, such as crutches, cane, or a walker? Or do they hold on to furniture when they're walking around? If they are on bed rest or the nurse is assisting them to ambulate, you can pick number 1. Do they have a IV or hep lock? The gait, do they have a normal gait? Are they on bed rest or in a wheelchair, or is it weak or impaired? How's their mental status? Are they oriented to their own ability, or do they forget their limitations? And it will give you a risk level as well as the score. Based on your risk level, you now have a list of interventions that we can address. We can go ahead and click into that field and say what you did. Maybe you educated the patient or the family, and what you might have educated them about. And enter. None of these fields are required fields, so if it doesn't apply to your patient, just skip it by hitting enter. If you received report from the oncoming shift, yes you did, or no. Yellow armband is on the patient, indicating they are at risk for falls. You can either type Y or N as well as clicking the buttons. Fall precaution sign over the bed. Side rails are up. Call bells in reach. Bed's in the lowest position. Staff is assisting to ambulate. They aren't ambulating at this time, so I'm going to go ahead and say no. And I'm working day shift, so I don't know if they have the light on at night, so I'm going to just skip that one. Assessment. I can go ahead and click into there and answer the questions. What is their age group? So this patient is, if I look back here, I can see the age at the top. They are 49. And what is their BMI? You can also see the BMI, we put it up here, so it's 21.68. So they are average. How is their mobility? Ambulated, limited, chair-bound. Do they use oral contraceptives? Trauma risk category. Have they had any of these types of injuries during this hospitalization? If not, just pick not applicable. Same thing with the surgical intervention. Are they scheduled to have any planned surgery, minor surgery, etc.? If not, then just say number 1. High risk diseases. Do they have any of these on the list? If not, pick number 1, and it will give you a risk level. Roles, relationships, and abuse. If they have any issues with risk, such as neglect, violence, abuse, etc. If not, number 1. And if do they have any signs and symptoms? No. Living arrangements. Who do they live with? They live in their own home with their spouse. They live in a safe environment. Yes, no, or unknown. Community resources. Do they utilize any of these? If they have any anticipated consult or education needs, discharge needs, or home equipment, you'd be able to document that. If not, just hit next screen. Is the patient able to provide risk information for the suicide risk? It's a yes or no question. If you say yes, then you will be required to answer these. So what is the patient's sex? Their age? Just go through and document the appropriate response to each of these questions. And it will give you a score and a risk level. Next screen. Is the patient diabetic? If you say yes, it will then ask you for what type. Do they do monitoring at home? What kind of management they currently use, and any consult requests. If you say no, that's all you have to enter. Do they have a history of MRSA? Yes, no, or they were unable to provide the information. If you answer yes to any of these questions, you will have the MRSA test automatically ordered. Transferred from a SNF. Scheduled for inpatient surgery, yes or no. And are they going to get dialysis as an inpatient? Next screen, the TB screen. So do they have any night sweats? How about recent weight loss, persistent cough, bloody sputum, and have they traveled out of the valley in the last 3 weeks? If they say yes, then you would need to document where did they travel to. This is more for the Zika virus. You can then double click where they've traveled. If they do have a pregnancy status, you can say pregnant, not pregnant, etc. And do they have any mosquito bites? The SARI screen, number 1, do they have a fever of greater than or equal to 100 or feverish now or recently? The question is yes or no. And the second question is, do they have a cough? Currently, the patient does not meet the criteria for a SARI swab. Do not collect. If we had answered yes to the first question, it would have told you to complete the collection with the kit and turn the SARI swab into the lab. finally, the last screen is updating the MDRO history. Do they have a history of MRSA, VRE, ESBL, or C. diff? If not, then you would select no, or you do have an unknown button. Once you are done and you have completed everything that is required, you will see this right side of the screen will be empty. You say OK, and to completely accept it and save it, you click the Accept button. Once you've done that, your admission assessment is completed. I can go back, close it, and you'll notice that it is now removed from my list. So after you've done your admission assessment, shift assessment, basically throughout the day you're going to go through your work list and complete whatever documentation. If the patient has left the unit and you cannot complete specific documentation, you can open up that particular item and cancel it off of your work list. If you click cancel, you'll just have to put in why you were canceling it, such as not in the room, hit enter, and accept the cancel. And that will remove that from your work list, so that way you don't have a bunch of charting that hasn't been done just hanging out on there. So you have your work list that you work through, you can document on. You also have your unscheduled documentation, which allows you to do other documentation that isn't ordered, such as if you get a critical result that is called to the unit on your patient, you are able to document that at any time. You can consider this your PRN charting. It's sitting there waiting for you to chart it. If the patient had a rapid response called for them, you would be able to document that within here. Condition changes on your patient. You can document what happened and how did you respond to it. You also have a documentation for just general entries, such as a nurse's note. Down here, number 111, we have the nursing note. It's completely a free text note. You would be able to open it up, put in a time for when you want this entered into the system, and you would just go ahead and start charting whatever you want, free text. You are able to document anything that you might need to put in on the patient. If you do not see a shift assessment, you can document that from here as well. Here's your routine charting if somebody else charted it. The work list is technically the work list for everyone to use per patient. So if the student is working that particular day, they would also be able to document any of the routine charting or any of the other documentation besides the admission or shift assessment. The nurse's aide can also document on the diet or the routine charting. So if those have been documented on and you still want to put in your own entry for that particular time, you can always go to the unscheduled documentation to be able to select something to chart. If you make a mistake and you need to correct any documentation that you might have entered, you can click on the expand button within the work list. It's in the bottom right hand corner, and it will display all of the completed documentation, including the items that were canceled. So here you can see that we completed these 4 items: the allergy, the height, weight, the home meds, and the admission assessment. And I can double click this to be able to correct anything. You can click on the correct supplement document button and select which you're going to be doing, and you can then go into that particular screen and be able to make changes as needed. Just click OK until you get an accept. Once it's filed, it has now been updated and it says corrected instead of complete. You can also close this by clicking on the little X and returning back to your main screen.